Hey everyone, Dr. Charlie Johnson, a physical therapist. And if you remember in a previous video, I talked about what could be going on if you have pain when you're walking, standing, or even lying flat, right? So I talked about if you're lying on a flat surface, how you might notice sort of like this little hollow in your lower back, or kind of if you stand in this position, super common in gymnasts, cheerleaders, even just everyday people. But if you've looked in the mirror and you've sort of noticed this arched back position, and you do get pain when you're standing, when you're walking, or when you're lying flat on your back, I talked about how it's very important to lengthen the front of the hips, right? So the hip flexors often become sort of short and pull you sort of into this tilt, okay? We call this an anterior pelvic tilt. Anterior just means that it's pulling it forward. So picture your pelvis, okay, as sort of a bucket, okay? And people who are stuck in this position, the water is kind of pouring out the front, okay? Hip flexors become a problem, right? And here's why. So if you look at me from a side view, I talked about how the hip flexors actually run from the hip up to every level of the spine. So you can imagine if these things shorten or contract, it's actually going to cause a little bit of this compressive effect on the lower back, okay, which can cause you pain or problems. The other thing is, if you look at just the right hip flexor from the front, it runs from the hip up to the spine, okay? So it can actually kind of like pull you to the side as well. So we're going to use sort of what we know about where these muscles attach to help you stretch it out and feel a little bit better, okay? So we're going to show you that now. Okay, so if you're constantly defaulting to this arched back position, okay, it could be because you can't see much of it, right? Because you have that stiffness in the front of the hip pulling you forward. So you have to retrain this whole idea that when your hip is in this position, kind of like when you're standing up, right, it's in that kind of straight down position, your back doesn't have to be in an arch, okay? So what you're going to do, okay, is you're going to picture the pelvis like a bucket of water, okay? You're going to tilt the pelvis backwards as if you're pouring the water out of the bucket, okay? So you're going to do that by basically tightening the belly. So you can see that when I don't tighten the belly, a lot of people kind of like arch in like this, and you get actually excessive arching in the back. No good. So what you're going to do is you're going to tighten the belly, pour the water out the back, okay, and squeeze this buttock. So I'm stretching the front of this thigh. If you remember, it attaches here, right? So by kind of like tightening it and then leaning forward, we're actually going to be lengthening that cord in the front. All right, so what you're going to do is you're going to squeeze the belly, tilt the pelvis backwards, pour the water out, and you're just going to, you might feel a stretch already in the front of the thigh. You're just going to kind of work into it, okay? So very gentle stretch, never painful, and you're just going to kind of drive into it a little bit. Everything's staying tight, drive into it. You'll feel stretch come on, stretch come off, stretch come on, stretch come off. Hang out there for a minute, okay? So that's stretching the hip flexor in one plane. The other way to stretch the hip flexor is from a straight on position. Is put a pillow down or something for the knees, okay? Is you're going to, again, same position, tilt it, tighten the belly. We're stretching this hip flexor. Remember how I talked about how it goes up from this point and attaches to the spine. So if you want to lengthen that, you just tilt the opposite way. So you're basically going to drive your hips this way in this case, and you're going to tilt opposite of the leg that's down, okay? And you're just going to work into this position to get a stretch in the hip flexor again, okay? All the meanwhile, your back is never arched because you've tilted the pelvis backwards, poured the water out, and held the butt tight, okay? So this is how you stretch or lengthen the front of the thigh properly. So you just do this a minute, kind of driving side to side, front to back on one hip, then go ahead and do it on the other hip, okay?